Imagine a world without nurses. You can't. In 1948, the University of Utah's College of Nursing was born, out of necessity. It was Hazel B. Mackin who led the new college as its first dean. Flash forward to 1969, when a new home was built for the rapidly expanding college. Now, 6 deans later, a new brand of leadership also grows out of necessity, navigating new challenges with fresh approaches.
Given that the roles of nursing have changed so much over the decades, that's impacted on how we educate nurses. So for example, within the College of Nursing, we educate nurse midwives, we educate nurse practitioners, and the scope of their practice is incredible. And so we have to make sure that they're well prepared for those roles. We're educating our students how to use the evidence that's out there so that we can have patients receive those optimal outcomes.
It's hard to sum up 75 years of excellence at the College of Nursing, but what better way to tell our story than through those who experienced it firsthand and went on to accomplish extraordinary things.
I really believe in natural healing. I believe that there are ways that we can support ourselves, mind, body, spirit. So when I was in the program, one of the things that was very important to me was that I knew that I needed to incorporate cultural appropriate health care. And how could I do that? Because I'm trying to incorporate my Native American roots with Western medicine. And I had the opportunity to design my own master's program. I mean, I still graduated with a dual master's in public health and health services administration, which was also very well-rounded because it gave me the administrative side of healthcare, the things that I would need to know to run a company. And the public health degree, allowed me to be in diverse communities.
We used to think that nurses did nothing more than change sheets and empty bedpans. Thankfully, much has changed. Over the years, the U's College of Nursing continued redefining the roles of nurses and encouraged graduates to innovative new technologies and treatments.
Critical thinking is a big part of, I think, how I was trained to think, to analyze problems. That critical thinking that I learned at the University of Utah College of Nursing was a basis for that. As the vascular access specialist at the VA, I formulated some ideas about how we can make better products for infusion therapy. And that got me started on a career of invention. Injection sites, like you see here, would oftentimes touch the skin or be contaminated in some way. It was necessary to swab the end of these injection sites with an alcohol swab to sterilize them prior to accessing them with tubing. And so we developed a brand of cap called the Dual Cap. And it's really gratifying when I walk into a hospital today and I can see a product that I originally conceived of in wide use.
Soon, student and faculty diversity began to grow at the college, expanding the cultural competency of graduates to better reflect the patient populations they serve, including championing those in the community who needed help most.
The University of Utah is very unique in that we have a contract with the Juvenile Justice Services so that we provide the care in the juvenile justice settings. So we go in and we're able to take care of these kids and provide correctional health care for them. We have a high bar that we have to meet, and we've had to kind of push the juvenile justice system to understand that that's the bar that needs to be met.
While the past 75 years have been filled with high national rankings and groundbreaking achievements, the U's College of Nursing isn't done expanding its reach and impact. Not even close.
I mean, I feel a sense of community in the College of Nursing with all my fellow students and my professors. It's like talking to a colleague, to a friend every day. I do believe that the College of Nursing at the University of Utah help us to prepare for the future and to, be the best nurse that we can be.
Nurses are changing the landscape of healthcare in the state of Utah, in the nation, and throughout the world. Our work matters. We are preparing nurses to work in any area of nursing required within this state. And I look forward to how now we and our next generation of students will take us forward for the next 75 years.